Hello, I am Dr. Harish Kumar. I am a consultant pediatrician at Aster CMI Hospital, Hebbad. Balanced diet is very important for a child. Diet is the building block for its growth. And balanced diet means what? Do not give wrong food to the child. That is, you have to avoid giving junk food, avoid giving sugar, any processed food, bakery items, or factory made products. Also restrict the milk intake as such, because nowadays the milk is not so healthy. Then give a lot of nutrient dense food. Lot of nutrition should go into the child, because child requires more nutrition than the adult, because child is growing. There need to be a positive energy going inside through food. So give a lot of vegetables, fruits, nuts, ghee, curd, dry fruits, and so on. Non-vegetarians can add up with the non-vegetarian protein to increase the protein intake. Then avoid giving all the unnecessary things in between, the snacks in between the meal, so that child becomes hungry and eats the right food as a main proper meal. Also try to give raw food, uncooked food. Some portion of the food daily should be raw. Raw food is really healthy because it increases the fiber intake, increases the digestive ability of the whole intestine. Growth is very much essential, and growth, when I say growth, it is physical growth, mental growth, as well as the emotional growth. To change the diet of a child, you need to change the diet habits. Changing the plate is not changing the food. Changing the habit of the eating pattern is very important. When I say change the habit, it is not the habit of the child alone. It is the habit of the whole family. It's been seen that a picky eating child is not the child develops the picky eating on itself. It is an interaction between the child's eating habit and the person who is feeding the child. So we call it as fussy child is a product of a fussy caretaker. So developing an habit of healthy eating depends on the whole family. This nutrition is very much essential for the child's growth, because the nutrition impairment leads to the growth impairment. It can be intellectual impairment, it could be mental impairment, or the physical growth impairment. Physical growth impairment can be seen as weight, height which is inadequate to the age appropriate norms, whereas mental development is very difficult to assess unless it is very profound. One of the example, if I have to give, iron deficiency. According to the NFHS 5, the present NFHS 5 data from Government of India, 50% of the children below 5 years of age are deficient in only one nutrient, that is iron. And iron is very important not only for the physical growth but also for the mental growth, the development of the intellect development, the brain development, overall brain development. So if at all there is some intelligence that is supposed to be developing within the first 2 years, 3 years, or 5 years of the child, and if that window period child has deficiency of this particular nutrient, that intelligence will not develop, and that lack of intelligence that is lost at that age cannot be recovered later. So a loss at that moment of the child is a permanent loss forever through its life. Hence, balanced diet leading to appropriate growth and development of a child is very, very essential.